Continuing on in your anatomy book, I'm on page 189 in your skeletal chapter, and we are picking up here now with the appendicular skeleton. So the appendicular, I already went through, is the extremities, starting with your clavicle and scapula, and then your arms and your legs, and it also includes your hip bones. Okay. So the scapula, along with the clavicle itself, make up the shoulder girdle. It's the whole joint, okay, where everything kind of comes together. I already went through the humerus and the radius and ulna and the fingers. Okay, olecranon and the olecranon fossa. Okay, these are terms, whoops. These are terms that are referring to a bump on the end of the long bones. And so here we have the olecranon fossa. Okay. And then we're going to talk about the epicondyles up here. Okay. And you have one on each side. And so these are the bumps and knobs on the ends of your long bones, which is how they all fit together. That's kind of what these terms are talking about. And these are the olecranon fossa, it says here, it prevents the hinge of the elbow from extending further. So that's what stops your arm from going backwards this way. You get it nice and straight and it stops. It can't go any further. And that's what that structure is that they're talking about. These are the names of all of those or your carpal bones that I told you had like 8 of them. Let me see if I counted right. 1, 2, 3, 4, 5, 6, 7, 8. Sweet, got it right. So you have 8 of them: the trapezoid, trapezium, scaphoid, hamate, pisiform, capitate, triquetrum, and the lunate. And so you have a anatomy picture and then an actual like bone picture, so you can see that, it matches. Okay. And then you also have, when it comes to the metacarpals, you have this one, and this one. Only this tip is, I take it back. Hold on. No. I'm going backwards. I'm going wrong here. So this is the hand. Okay. So I just drew a line like where your knuckles are. So everything beyond is the actual finger. And because we know our finger bends, we know there's different bones there. And that's what this is. 1, 2, and 3. Okay. So now we're going to talk about our directional terms. Proximal, means closest to the point of origin. Medial is the middle, and distal is farthest from the point of origin. So using those words, we can now tell you exactly which bone the person broke. First finger, or pointer finger, they actually consider that to be the second. The thumb is 1. So it's the second finger, distal phalange. I broke this bone. Proximal phalange, I broke this bone. Medial is the middle one. So which finger, which section, and you can code it. Because that's where we're heading, right? This mod is we're going to be coding for all of these bones. Okay. Your lower extremity, we already ran through all of those. And your foot works the same way. Okay. The tarsals, which are your ankle bones, your biggest one is called the calcaneus, and that's what you and I call our heel. Okay, it's actually called the calcaneus bone. But then we have the talus, we have navicular, cuboid, and then the cuneiform. We actually have 3 different cuneiforms, so we'll call it cuneiform 1, 2, and 3. And so those are all the names of the tarsals. Do you have to memorize those? No. If you go work for a podiatrist, are you going to have to learn those? Yeah, you do. And then just like your hand, your metatarsal, which is the length of your foot, and then your phalange is your toe, and you have proximal, middle or medial, and distal, except for your big toe. You can see there's only 2 there. There isn't 3. So there is no middle. So it's proximal and distal when we're talking about the big toe. Your foot is supposed to have a nice natural arch, and it's supposed to both lengthways and sideways. Obviously, people can have a lot of issues with that, a lot of issues with your foot pronating one way or another. Flat feet, bunions, all kinds of foot conditions, which I have a pretty close relationship with my podiatrist. He's done 7 procedures on my feet. So I've had a number of those. Palpable bony landmarks. These are the bones that you can find on yourself by feeling around a little bit. So that's what palpable is, to feel. So the zygomatic is your cheekbone. Do a little feeling, there it is. The clavicle, the acromion process of the scapula is where things are fitting together. And if you get in there and just right, and you go, oh, there it is. You can feel your different bones and different projections of different bones. All right. What is the difference between a male skeleton and a female skeleton? There are differences. You'll be watching some, Law and Order or NCIS or Bones or something like that, and they find a skeleton with no tissue left. It's just bones, and they can tell very quickly if it's a man or a woman. How? Okay. Well, the book likes to mention size, but we all know size is not a predicting factor of gender. We all probably have known very tall women and very short men. So height itself is not a deciding factor. It's one of those initial things where they're like, I think it's going to be, but then once they start investigating, they realize they might have been wrong. The thing that you need to look at is the pelvic bone itself. Clearly, one difference between a male and a female body is the ability to carry and birth a child. And so our pubic bones are designed to either carry a baby or not, depending on what gender you are. And so they show here that in the male body, this is circular, and this is a thinner angle, a smaller angle. So it's got like the peace sign going upside down. Okay, it's kind of like that. But in a woman, they consider this to be like basin-shaped or oval-shaped, and the angle is much larger, like this. Okay, because we have to be able to get a child's head through that opening, okay. And a man does not. I don't know why we didn't, it wasn't just created the same. Like, what's the difference? Why, but that's just the way it is. Okay. In a woman, that tailbone, that coccyx is right back there. It's there, of course, in a man too, but that gets problematic when having a baby. A lot of women have tailbone issues. The other thing, in a minute, we're going to be talking about joints of where bones come together. And this right here, come on. This right here is considered to be a joint. It is where 2 bones come together. So in a woman having a baby, as the hips open, that joint is where it's opening from. That's where the movement is happening. Okay. So we'll talk about that joint in the pubic area later. So I just wanted to point it out here while I had it on the screen. Age differences, they can tell some aging based on looking at a skeleton. They can certainly tell from that epiphyseal plate and epiphyseal line if you're dealing with a child, because you could have a skeleton that is estimated to be 6'2", 6 feet 2 inches, but if the epiphyseal line is still open, that means they've not reached their adult height. Maybe that's an 18-year-old who still had a few more inches to grow. Okay. My son has a missing tooth, and when he got his braces off, he has this hole, and he needs an implant. But he was 16 or 17 when he got his braces off, and the dentist said, we don't want to put the implant in now. He's not full grown. And I look at my son, who's like 6'2", that, oh my God, he's not full grown yet. But why risk it and put an implant in if the head might change shape just a little bit? We didn't expect it to be a lot. Well, now my son's 20. We're still not there yet. But he has a filler tooth in, so cosmetically, he is not missing a tooth. But at some point, that filler tooth may come loose, and he might lose it, and we might have to now pay for that implant. And he was born that way. He had a crazy tooth that we had actually had to pull out. He had 2 teeth that were actually fused together. So it looked like he had a third front tooth, but it wasn't front teeth. It was actually canines that were fused together. They called it a Gemini tooth. Okay, age differences. So we can tell some age difference. We can tell some aging from a skeleton. So we can tell if they're young. We can also tell kind of how old some of the bones are. We can tell if they have osteoporosis, which is an older person's disease. And they say that an elderly skeleton weighs much less than when you were in your 30s. So I'm looking forward to that weight loss. No, not really looking forward to it, but hey, I won't be sad if my scale has got a lower number on it. Okay. All right. Environmental factors, not a lot in this section. You can see it's a very short paragraph. We talk about the vitamin D again, which we've already talked about when we talked about the skin, but that was this mod, so you've already heard that, about how vitamin D plays a part into our growing. Calcium we talked about already in this chapter, about it being a very important mineral. So make sure you're getting enough in your diet or you're taking supplements. Especially important if you're a woman because of menopause and things like that. Calcium is a really important vitamin for everybody. But okay, that's where we're going to end this video. So we're going to pick up the next video and cover all the different kinds of joints in the body. There's a lot there to learn, so stick around.